afternoon, everyone. Myself, Dr. Kirti, Assistant Professor, Physiotherapy Department. So, today I'm going to tell you about parts of adult long bone. So, long bone shows the following features. First, we are having the shaft from without inwards. We are having the periosteum as discussed in the previous PPT. Cortex, which is made up of compact bone, which gives strength to the bone. We are having the medullary cavity filled with bone marrow and the two end of the long bone made up of cancellous bone covered with the hyaline cartilage. Structure of lamellae. Adult bone is made up of layers known as lamellae, and each lamellae is a thin plate of bone consisting of collagen fibers and mineral salts which are deposited in gelatinous ground substance. And between adjoining lamellae we see small flattened spaces or lacunae, and each lacuna contain one osteocyte. And each lacuna communicate with neighboring lacuna by fine canals known as canaliculi, and these canaliculi are occupied by delicate cytoplasmic process of osteocytes. Structure of cancellous bone. The bony plates or rods that form the meshwork of cancellous bone are called tubercles. Each tubercle is made up of number of lamellae. The tubercle enclosed white space which are filled in by bone marrow, and they receive nutrition from blood vessels in the bone marrow. So in this cavity containing the blood vessels and red bone marrow. So structure of compact bone, in which the lamellae are arranged in the form of concentric rings surround a narrow Haversian canal present at the center of each ring. The Haversian canal is occupied by blood vessel, nerve fiber and some cell. One Haversian canal and the lamellae around it constitute a Haversian system or osteon. The compact bone consists of several such osteons. Between adjoining osteons, there are angular intervals that are occupied by interstitial lamellae. So, near the surface of compact bone, the lamellae are arranged parallel to the surface. These are called circumferential lamellae. Haversian canals run along the length of bone, and these are canals which communicate the Haversian canals and external surface, known as the Waxman canal. So this is the diagram showing the compact bone and its internal structure. So the bone constitution, basically it is made up of organic, inorganic and water part. So 25% is organic, bone cells, intracellular matrix, and inorganic is 65%, which include crystalline, amorphous and ions like calcium, phosphate, potassium, magnesium. So bone and calcium, bone stores about 99% of body calcium. If serum level of calcium falls below the normal value, then body may increase the intestinal absorption, decrease urinary excretion, and may increase the release of calcium from bone. And the factor responsible for monitoring these activities are parathyroid hormone, vitamin D, and calcitonin. And in case of acute lowering of serum calcium level, the first supply of calcium is lacunar and canal canalicular surface of the bone. After this source depleted, the parathyroid hormone secretion is stimulated and provide a second source of calcium from bone from zone surrounding the osteocytic osteolysis. And third source of supply is the large mass of cancellous bone. And finally, the cortical bone becomes a source of calcium. This occurs by action of osteocytes, and this resorption is osteoclastic resorption. So, thank you.